Hello, I'm doing my online residency program with Health Carousel, and today I'll be completing the module about outcomes and indicators heart failure. Okay, there we go. Let's see. Here are some basic instructions for navigating this course. Okay.
This program is designed to provide an overview of heart failure, discuss signs and symptoms, and describe interventions related to the care of the person diagnosed with heart failure. The program will support clinical professionals in applying the best available evidence in practice as it relates to heart failure. After completing the course, the student should be able to list assessment findings of the patient with heart failure, identify typical diagnostic tests for the patient with suspected or confirmed heart failure, demonstrate knowledge of interventions for heart failure.
Okay.
Click on each item for more information. Value-based purchasing describes care purchased by an insurance company from an organization based on the quality outcome measures for that organization. For example, an insurance company is more likely to pay for care from an organization with better patient outcomes than from an organization with poorer patient outcomes. Reimbursement may also be guided by the use of the outcome measures. Measures that evaluate the results of overall care, for example, mortality, readmission rates, hospital-acquired infection, but that do not evaluate whether or not specific interventions were performed. Complex syndrome related to cardiac disorders of structure or function that diminish ventricular filling or emptying. The syndrome is also marked by elevated natriuretic peptide or clinical symptoms of fluid overload, pulmonary or systemic. Classification of heart failure will help the care team determine which medicines or devices are indicated. According to the CDC, heart failure affects 6.2 million people in the U.S. Heart failure exacerbation is one of the leading causes for hospital readmission. Heart failure is broken down into stages and classifications by EF. This slide reviews each stage and what is expected at each stage, along with the classifications by EF. Stages are important when considering treatment options. Patients who are classified with Stage A are at risk without current or prior symptoms of heart failure. They do not have any structural cardiac changes, nor do they have elevated biomarkers of disease. Stage B patients also are without current or prior symptoms. However, they do have evidence of one of the following: structural heart disease, abnormal cardiac function, or elevated natriuretic peptide or troponin levels. Stage B is also known as the pre-heart failure stage. Patients with Stage C currently have or have had prior symptoms and or signs of heart failure, including structural and or functional cardiac abnormality. Stage D, advanced heart failure, is the final stage. It is characterized by severe symptoms, recurrent hospitalizations despite guideline-directed medical therapy, or GDMT, refractory or intolerant to GDMT, and requires advanced therapies, including transplant, mechanical circulatory support, or palliative care. Common symptoms of heart failure include shortness of breath, difficulty lying flat, lower extremity swelling, decreased activity tolerance, fatigue, and weight gain. Less common symptoms include coughing, feeling of abdominal distension, poor appetite, and feeling lightheaded. An ECG is usually done to diagnose underlying conditions that cause heart failure, including previous myocardial infarction. Chest X-rays may show an enlarged heart and fluid in the lungs. Laboratory studies used to diagnose heart failure include B-type natriuretic peptide, BNP. BNP is released into the bloodstream when pressure changes in the heart occur. It is highly predictive of heart failure. An echo will provide information about the heart's overall mechanical function, as well as the ejection fraction, which helps determine heart failure classification. A stress test may be done to evaluate heart function under stress. This can be done with or without activity. The diagnosis of heart failure may be confirmed by several different studies, as well as the patient's clinical presentation. An angiogram is a test that uses a dye to follow the blood through the heart. This test checks for arterial narrowing and left-sided heart function. Classification of heart failure will help the care team determine which medicines or devices are indicated. An 89-year-old patient was admitted to the floor with a new diagnosis of heart failure. They have a history of an MI 2 weeks ago, which was treated with stent placement. The patient currently presents with anxiety and reports difficulty catching their breath. During the physical assessment, the nurse may hear which abnormal lung sound often found during acute heart failure. Which of the following abnormal heart sounds will the patient's nurse be most likely to document during the morning assessment? Each patient suspected of having heart failure should receive a full evaluation after acute symptoms are addressed. Stabilize abnormal heart rhythms, for example, antiarrhythmics, pacemaker. If heart failure is suspected or confirmed, avoid using IV vasodilators such as nitroprusside that may suddenly decrease blood pressure. Reduce both preload and afterload with diuretics, opiates such as morphine, and nitroglycerin if coronary perfusion is inadequate. If the patient has both heart failure and low blood pressure, consider inotropes and vasopressors on a case-by-case basis. Add a beta blocker and an ACE inhibitor, or ARB, if the patient is not already prescribed these medications. Monitor daily weights, I&O, HR, and BP. Monitor renal function and electrolytes. Medical therapy for heart failure includes several classifications of medicines, and treatment depends on the stage of heart failure. Medications include ACE or ARB, beta blockers, angiotensin receptor neprilysin inhibitors, ARNI, mineralocorticoid receptor antagonists, MRA, and sodium glucose cotransporter 2 inhibitors, SGLT2I. Non-pharmacological treatments or self-management should be tailored specifically for self-management of heart failure. Consider utilization of a multidisciplinary heart failure team for symptom management and provider notification. Studies demonstrate that patients who are well-versed in self-management techniques have fewer exacerbations and complications of heart failure. Maintain healthy habits such as exercise, healthy diet, weight management, and smoking cessation. Vaccinate against respiratory illnesses. Screen for depression and other social determinants of health. Monitor tolerance of medication dosage adjustments prior to discharge. Provide written and verbal instructions specific to the patient's heart failure and types of medications, as well as any signs and symptoms that should be reported. Encourage the patient to follow up with heart failure specialist or team soon after discharge. Include a caregiver when possible during education. Utilize teach-back methods during education to increase retention of information. Click on each item for more information. Common symptoms include shortness of breath, difficulty lying flat, lower extremity swelling, decreased activity tolerance, fatigue, weight gain. Less common symptoms include coughing, feeling of abdominal distension, poor appetite, feeling lightheaded. Evaluation of underlying causes of heart failure includes electrocardiogram, echocardiogram, and chest x-rays. Treatment of underlying causes may include repairing faulty heart valves, stabilizing the heart rhythm, and clearing arterial blockages. The BNP level is used primarily in the diagnosis of heart failure. To evaluate underlying causes of heart failure or contributing factors to the disease, the patient may have laboratory workup, including electrolyte levels, cardiac biomarkers levels, kidney function tests, monitoring of intake and output, CBC, urinalysis, glucose, lipid profile, liver function tests, iron studies, thyroid stimulating hormone. Pharmacological management of the patient with heart failure may include one medication or several. Use of an ACE inhibitor may slow the progress of heart failure. Beta blockers preserve cardiac function while allowing the heart to work more efficiently. Diuretics decrease fluid volume that can cause congestion in the heart, lungs, and swelling in the abdomen and feet. Patient self-care involves managing modifiable risk factors to reduce complications, that is, morbidity. Self-care of the patient in heart failure involves thorough patient education and support from healthcare providers. In review, treating heart failure involves, first, identifying the symptoms, evaluating and treating the underlying causes of heart failure, third, reviewing and managing medications, and fourth, educating and supporting self-care activities, which includes regular follow-up with a heart failure specialist team.
Wow, this is very nice. All right, outcomes. Heart failure, goal to other interventions most likely to improve outcomes for patients at risk for or diagnosed with high profile medical conditions. Prevention and address modifiable risk factors for heart failure, such as hypertension, myocardial infarction, and kidney disease. Support public education regarding the identification and treatment of modifiable risk factors for heart failure. Assessment. Common symptoms include shortness of breath with or without crackles or wheezes, difficulty lying flat, lower extremity swelling, decreased activity tolerance, weight gain, abnormal heart sounds. S3 may be present. Less common symptoms include coughing, feeling abdominal distension, poor appetite, feeling lightheaded, confusion, jugular vein distension, or JVD. Diagnosis: 12-lead electrocardiogram or ECG, chest X-ray, B-type natriuretic peptide or BNP, highly predictive of heart failure. Advanced diagnosis: echocardiogram or echo, stress test with or without activity, coronary angiogram, valves or wave the heart arteries and left-sided heart function. Treatment: acute inpatient IV diuretics such as furosemide or Lasix, stabilize abnormal heart rhythm, antiarrhythmics, pacemaker. Consider opiates, nitrates, inotropes, and or vasopressors. On case-to-case basis, non-recommended for routine use. Add a beta blocker and ACE inhibitor if patient is not already prescribed these medications. All right, Prill. Avoid using sodium nitroprusside for heart failure patients. Monitor daily weights, INO, HR, and BP. Monitor renal function and electrolytes. Outcomes and indicators. Treatment of heart failure per stage. Stage A, at risk. Treatment is focused on managing underlying conditions such as hypertension and diabetes. SGLT2I is recommended for some patients depending on risk factors. Stage B, pre-HF heart failure. Medications include ACE inhibitors, ARB, if unable to tolerate ACE inhibitors, beta blockers, and statins, implantable cardioverter defibrillator, or ICD, depending on risk factors. ICDs can prevent sudden death from lethal arrhythmias. Stage C, HF, heart failure. Medication include ACE, ARB, or ARNI, beta blocker, MRA, SGLT2I, and diuretics is needed. Device and surgical treatment includes ICD, cardiac resynchronization therapy, CRT, mechanical circulatory support, cardiac transplant, sodium restriction, recommended registered dietitian consult for diet modification. Advanced HF medication include those of stage C, device and surgical treatment, is ICD, team. Discharge, give written discharge instructions specific to heart failure to patient and family if available. Encourage patient follow-up with heart failure specialist team soon after discharge. Educate on importance of keeping follow-up appointments even if feeling improved. Review symptom management and when to notify a provider. Reduce alcohol, stop smoking, stay active, normalize weight, reduce cholesterol, obtain adequate rest, decrease salt intake. All right, that's it. Let's answer. Hostess. I have to get 6 out of 7 questions. Which previous medical event may have precipitated a patient's new onset of heart failure? Diabetes. The patient has been given a beta blocker to preserve heart function. The patient will most likely receive which additional type of medication to help treat heart failure? ACE inhibitor. The patient is admitted to the hospital 3 months after initial heart failure diagnosis with exacerbated shortness of breath for the last few hours. Their vital signs are 110 beats per minute, RR, 26 beats per breaths per minute, 94/64. What was that? 95% nurse notes down crackles, shortness of breath, and anxiety upon assessment. Given the patient's history, the nurse should anticipate which of the following minimum sets of tests or interventions: ECG, BNP levels, stress tests. I like the BNP levels. Yeah, 94/64. ECG, heart. ECG, BNP chest X-ray. ECG chest X-ray, BNP levels. I'm thinking of this too. Serum sodium potassium. 10 per hour, that's too long. I need to know now. Okay, let's see. During the patient's hospital stay, the nurse should carefully note the daily observation which of the following. Wait. Okay, next. Which of the following medications is used in acute management? Acute furosemide Lasix, nitroprusside, acute management. Is it nitroprusside? Acute management. Oh, acute management. Sodium nitroprusside. Floor management. Sodium nitroprusside. It is a potent vasodilator. Sodium nitroprusside. Consider okay, saturates inotropes. Add a beta blocker. Diuretics, acute inpatient diuretic. Furosemide diuretic. Which diagnostic test is most accurate for assessing the heart's mechanical function? Echocardiogram, electrocardiogram, echocardiogram, ECG, electrocardiogram, treatment failure, electrocardiogram, It's not modifiable, cannot be changed. Oh, 5 out of 7. Oh no. Correct answer is myocardial infarction, MI. Okay, ACE inhibitor. Yes, BNP levels X-ray. Weight, correct. Furosemide, correct. Electrocardiogram. Echocardiogram, mechanical function of heart and determine ejection fraction. And diabetes, it should be MI. Okay, retake. It should be myocardial infarction. This is ACE inhibitor. Chest X-ray, BNP levels, weight, furosemide, echocardiogram, and race, gender. Okay, 100%. Oops. All right. I'm done. Thank you for watching. That's it.